Hi, I'm Elzatra So, Associate Behavioral Scientist from the Desmond Tutu Health Foundation. I've been working for more than 10 years in providing sex reproductive health services and research to young people in community-based settings. My project looked about how can we center women and girls in healthcare and research, and also catalyzing institutional change. So this was done by establishing dyads of research principal investigators and young women community investigators so that they together can inform gender responsive and community-led clinical trials and implementation in South Africa. This project integrated young women aged 18 to 27 years into these dyads so that they can be part of the organization's research leadership and jointly make decisions. So, if we really want to decolonize global health, we must address the relationship between global health actors, which are the researchers and pharmaceutical representatives, and young women clinical trial participants. Organizations like UNH and WHO have increasingly recognized that it is important to include communities if we really want to make sustainable impact with public health interventions. While most people in the research field has done some minimal engagement like youth advisory boards and speaking to young people maybe at the start of a study and towards the end, we've not really seen substantial engagement where you make those young people part of your research team and they become youth researchers, co-creating and having a say in research and outputs. So in Eastern and Southern Africa, those are adolescent girls and young women who are disproportionately affected by HIV, STIs, and unplanned pregnancies. So their voices in the design and implementation of sex reproductive health research and programs are really crucial. However, little guidance on how to incorporate sustainable community inclusion successfully exists. So in my project, I aim to co-design what does a curriculum look like when a PI and young women community investigators go through a training program to really understand how they can work together so that we can have this gender responsive and community-led research and programming. So this included training of both the researchers on good participatory practice and the training of young women on different research principles, decision making, making their voice come across and really taking up space in these research meetings. This was done through co-creation workshops, and then these young women and the researchers get paired up and start becoming part of clinical trials with the hopes that the output is a framework of what is best practices and processes when we really want to include young women investigators in clinical trials, and then hopefully have funding allocated by major research donors and pharmaceutical companies for this in the future. So my current progress. We've conducted the formative engagement with young people and senior researchers. And here to the left, we really see what has been some of the feedback that they've given. The researchers giving input on what are the workshops, what are the knowledge that on research that really need to be brought across to young people. But also in this engagement, seeing them starting to acknowledge that how much this could break the stigma when we bring projects to communities, and also acknowledging that we don't understand all young people and how to provide services for them. And then young women in the engagement starting to speak about how respected they feel when they see their ideas in action, when they are consulted, and that making the programs more successful. Unfortunately, my program was implemented during a time of big funding cuts in this field. So I was only able to secure funding and employ two young women community investigators to date, and then formed the dyad with two PIs. They've gone through some of the training and have now formed part of one of the projects where they will provide input as well. So in this leadership journey has been really great for me to really start working on my leadership voice. Like, how do I lead with purpose and bring these ideas across? I think what stood out the most for me was the principles around inclusive leadership. How do I address power dynamics that we see between researchers, pharmaceutical companies, and the community? How do I amplify the voices of people in the community and the young women in the community, and gives just a step back so that they can bring across their expertise, but then also inspiring action in other female researchers to become allies when we bring young women into the decision making spaces when it comes to research and programming that will benefit them. Thank you.